Hi, my name is Moises Ceballos and I'm going to talk about the causes of defects in birth. In definition, a birth defect is a problem that happens while a baby is developing in the mother's body.
We know the cause for some birth defects, but for most, we don't. That's because we think most birth defects are caused by a complex mix of factors. There are some factors that can increase the chance of having a baby with a birth defect. These are called risk factors and include smoking, drinking alcohol, or taking certain street drugs during pregnancy. Having certain medical conditions, such as obesity or uncontrolled diabetes. Taking certain medications, such as some acne drugs. Having someone in your family with a birth defect. Being an older mother, typically over 34. And exposure to some chemicals and viruses during pregnancy. Having one or more of these factors doesn't necessarily mean your baby will have a birth defect. It is important to talk to your doctor about what you can do to improve your chances to have a healthy baby.
Okay, in physiotherapy applications, the physiotherapists work with a multidisciplinary team in which everyone collaborates for the well-being of the patients. And physiotherapy aims to give people functional independence while maintaining mobility and correcting the deformity.
طيب ايه التكنيكس اللي احنا بنستخدمها في ال NDT نيورو ديفلوبمنتال تكنيك؟ في تكنيكس بنستخدمها عشان نحقق الاهداف اللي احنا قلناها. اول حاجه بنستخدم ريفلكس انهبيتنج باترن، تمام؟ ريفلكس انهبيتنج باترن using key points of control. عندنا احنا كده اتحددت key points of control في الجسم، بوبث حددت key points of control في الجسم. key points of control دي بتأثر على التون بتاع الجسم سواء كان فليكشن تون او اكستنشن تون. دي اول حاجه. تاني حاجه بنستخدمها في ال NDT الهاندلنج. بنعلم البيرنتس او الكير جيفر اوف ذا تشايلد طريقه الهاندلنج بتاع التشايلد عشان برضه نحقق ان احنا نعمل انهبيشن للابنورمال ريفلكسز and facilitate the normal response in meaningful functional way. تالت تكنيك بنستخدمه في ال NDT ان احنا بنعمل facilitation للايكوليبريم and writing reactions. رابع تكنيك بنستخدمه برضو، كل ده بنستخدمه مع بعض على فكرة، ان احنا بنعمل stimulation sensory stimulation by weight bearing, tapping, joint compression. All sensory stimulation are used during the technique. The optimal usage of Popeth is to integrate all these techniques at the same time. يعني احنا المفروض نستخدم كل التكنيكس دي مع بعض، مش بس مجرد ان احنا نستخدم الكي بوينت اوف كنترول وخلاص، لا، لازم نعمل inhibition abnormal facilitation للنورمال موتور موفمنت بما يواكب النورمال موتور ديفلوبمنت اوف ذا تشايلد في شكل فانكشنال، في شكل حركه فانكشنال. وفي نفس الوقت ان احنا بنستخدم السنسوري انبوت، السنسوري ستيميوليشن زي الابروكسيميشن او الجوينت كومبريشن او الويت بيرنج او التابنج، وفي نفس الوقت بنشجع الايكوليبريم اند رايتنج رياكشنز. طب هنعمل كل ده ازاي كله مع بعضه؟ هوريك دلوقتي تكنيكس او بوزيشنز بنستخدمها عشان في البوبث، وهقول لك كل الايمز اللي احنا بنستخدمها في البوبث during using these techniques.
And pros and cons. Pros, early care improves the life of a patient, facilitating recovery through brain plasticity. The functional adaptation capacity of the central nervous system to minimize the effects of structural or psychological alterations regardless of the original cause. And cause, sometimes the injuries are very serious that end in complex syndromes that have a poor prognosis for life.
Pros and cons of natural birth and cesarean section. Usually a woman is granted the power to choose how she wants to deliver her baby. Why she opt for a surgical procedure over a natural birth, or vice versa. Obviously, there are many pros and cons to each delivery method. The important message is that both vaginal and cesarean section are safe. If you compare a vaginal birth that goes well and a cesarean section, a vaginal birth is still far safer. Health concerns makes a doctor to recommend either natural or C-section births. But how does each delivery method affect the mother and baby? Natural birth pros. Shorter recovery time and hospital stay. Feels more natural for the mother. Give women a great sense of empowerment and accomplishment. The baby's risks for many health issues including certain respiratory problems, persistent pulmonary hypertension, asthma, food allergies, and lactose intolerance are less. Labor may be shorter and move along quicker with future births. Babies are able to breastfeed sooner. Speeds up the bonding process. Natural birth cons. Unforeseen complications can occur during labor and delivery. Baby faces the risk of oxygen deprivation. Baby experiences physical trauma while passing through the birth canal. Mothers have high rates of urinary incontinence or urine leaks. Cesarean section pros. Mothers don't have to endure long hours of labor. Usually scheduled when they want to give birth. Women are at decreased risk for pelvic floor injury and birth trauma. Avoid post-term pregnancies. A baby's risk of being infected with the mother's STD or infection is greatly reduced. Cesarean section cons. Surgical risks and complications from anesthesia. Women are at increased risk for serious health complications such as heart attacks, blood clots, and postpartum infection. Babies are at higher risk for persistent pulmonary hypertension. Some mothers who have C-sections will not have the option of vaginal birth in the future due to risk of abdominal tears from pushing. Thank you.
Okay. This will apply in Ecuador. One out of everybody 100 babies in Ecuador is born with a birth defect. In conclusion, birth defects can be caused by genetic problems, chromosomal problems, infections in pregnancy, exposure to medication, chemicals, or other agents during pregnancy.
The good news is most babies are born healthy, but every woman has some risk of having a baby with a birth defect. About 3% of babies born in the U.S. have a birth defect. What does 3% look like? Imagine a room with 33 pregnant women. Out of that group, there may be one whose baby has a birth defect. There are many kinds of birth defects, and usually they happen unexpectedly. Birth defects can range from very mild to more severe. Some are physical, like cleft lip. Some cause medical problems, like cystic fibrosis. Some result in intellectual disabilities, like Down syndrome. And some run in families, like sickle cell disease. One common type of genetic birth defect is a problem with chromosomes. Chromosomes are packages of genetic instructions found in each cell of our bodies. Extra or missing chromosomes can affect the baby's health, physical appearance, and mental development. This kind of birth defect usually does not run in families. Women of any age may have a baby with a chromosome problem, but the chance of having a baby with this kind of birth defect increases as you get older. If you wish to have information during your pregnancy about some birth defects, consider having prenatal screening or diagnostic testing. To learn more about your choices, continue to the next section of the program.
So, thank you so much for your attention.